I have been here in this practice for the last 7 years, and I came here from Virginia when I met Dr. Pilcher, and I was very intrigued with the way they had their program going down here. And since I've joined, the practice has increased exponentially, and that includes all the various services that are available for patients. And it is a comprehensive, wonderful program that I feel that we do weight loss surgery the right way. One thing I do want to mention is the fact that weight loss surgery is no magic bullet for weight loss. You owe it to yourself to educate yourself. Go to the internet, go to friends and family, go to your doctor, go to other patients who have had surgery. Spend the time, become as aware as possible, because a patient who is educated coming into surgery is going to be much more successful after surgery. You also owe it to yourself to try a myriad of diets. If you find one that works for you, that keeps the weight off over the long term, that's wonderful, because dieting is a lot less risky than surgery. But for most patients, they will either not lose enough weight or will lose the weight and then gain it back. This is extremely common, but you do owe it to yourself to give it a try. After surgery, your body goes back to its normal functions. After gastric bypass, there's a piece of intestine that has been bypassed, and so various things like iron and calcium will not be absorbed quite as well as they would be before surgery. Because of this, we do ask that you take extra vitamins and iron after surgery, but other medicines and foods are absorbed just like they would be normally. After surgery, especially right after surgery, you will be eating very small amounts. For a patient who's immediately after surgery, a nugget-sized piece of chicken may be an entire meal, and that may be an entire meal for the whole day. As you gradually get further away from surgery, things loosen up inside and you're able to take in more, but for most patients that ends up being about the amount of a 10 or 12-year-old child. We want you eating 3 meals a day maximum, because that makes sense to us. We don't want you eating all the time, because then you can gain your weight back. One of the things that we also ask is that you not eat and drink at the same time. Now, that does not include alcohol, but speaking of alcohol, alcohol is a high-calorie liquid, and it's not worth drinking over the first year after surgery while we're trying to get as much weight off of you as possible. And so we do ask that you hold off on alcohol for at least a year. After that, having an occasional drink is not a big deal. Again, alcohol is a high-calorie liquid, so you have to think about the fact that it will go straight down. You'll get all of the calories and none of the fullness. So that's one of those things about in changing your life that you've got to consider ahead of time. Weight loss surgery has a tremendous impact on various medical problems. The biggest being diabetes, and this is type 2 diabetes we're talking about. For most patients who've had gastric bypass, they will leave the hospital 2 or 3 days after surgery without requiring any diabetic medication. Occasionally patients will still need a oral hypoglycemic, but that's extremely rare. The cause of that is not exactly known, the mechanism, but there are researchers on it day and night trying to figure out why exactly that happens. With the lab band, the impact on diabetes is much slower. You actually have to lose the weight in order to have the diabetes begin to resolve. But with gastric bypass, the diabetes is almost completely cleared pretty quickly. 2 to 3 days is pretty quickly. With other medical problems, sleep apnea, for most patients after you've lost about 40 or 50 pounds, you won't need the CPAP machine anymore. For high blood pressure, it generally takes about 6 to 9 months before you start seeing significant drops in your blood pressure medicine, but that can even occur earlier in some patients. High cholesterol, again, 6 to 9 months or so, you start seeing a significant decrease in your cholesterol levels. Some other various medical problems are the joint pains, reflux. Those things are all impacted in a positive way after surgery, and generally pretty quickly. For most patients who are having weight loss surgery, I'll break it down into the bypass versus the band. And for the gastric bypass, your surgery lasts for an hour or two. You're home at 2 to 3 days. You come to see us at 2 weeks, and you're back to work at 2 or 3 weeks. With the lab band, a lot of them can be done as an outpatient procedure, so you're home the same day. Back to see us at about 2 weeks, and then a weekly visit for a while until the band is adjusted the way it needs to be. And most people take 1 to 2 or 3 weeks off from work before going back. After surgery, as your weight reduces, your medical problems will gradually improve, and so your need for medication will also decline. You will need to be taking some extra supplements after surgery, including iron and calcium and possibly B12. But other medications are generally well tolerated. There are a few that will need to be discussed with your doctor for around the time of surgery and then for the rest of your life. But these are few and far between. The decision to have surgery is a life-changing one, and you need to come into it with your eyes wide open. You need to be ready to change your relationship with food and change your life. We are going to be here to support you, and we expect some things from you. We have a set of rules and guidelines that will help you over the long term with keeping that weight, getting the weight off to begin with, and keeping the weight off over the long term. These rules and guidelines will be gone over with you at some point with your doctor here, and we'll talk about them some in the seminar when you come. We're very much looking forward to meeting you, and we want to be there when you have your success, and we want to see you over your lifetime.